It was a Tuesday morning when Margaret walked into my office, and she said something I'll never forget. She looked at me and said, "Doctor, I do everything right. I eat my vegetables. I take my walks. I don't smoke. So why does my chest feel heavy every single morning?" Margaret is 72 years old. She's the kind of patient who follows every guideline, reads every pamphlet, and genuinely cares about her health. And yet, like so many of my patients, she was unknowingly doing something every single morning that was putting unnecessary strain on her heart. And here's what concerns me most as a cardiologist. This isn't some rare behavior. It's something millions of older adults do without thinking twice. It feels normal. It feels automatic. And because it happens so early in the day, most people never connect it to how they feel hours later. My name is Dr. Anderson, and I've been practicing cardiology for over 20 years. I've worked with thousands of patients, many of them in their 60s, 70s, and 80s. I've seen heart attacks, I've managed chronic conditions, and I've watched people make small changes that genuinely improved their quality of life. But I've also seen patterns that don't show up in a single test or a single moment, but patterns that emerge when you sit down with someone and really listen to how they start their day. Today, I want to talk to you about one of those patterns, not to scare you, but to help you understand what's actually happening inside your heart in those first critical hours after you wake up. Because when you understand what's going on, you can make informed choices. And that's what this is really about, giving you the knowledge so you can protect your heart in a way that makes sense for you. So let's start with something you probably already know, but maybe haven't thought about in a while. Your heart doesn't work the same way all day long. When you're asleep, your heart rate slows down, your blood pressure drops, your body goes into a kind of maintenance mode, repairing tissues, processing the day, conserving energy. It's a beautiful, restful state. Your cardiovascular system is at its calmest. But then you wake up, and everything changes. In clinical practice, we often see something we call the morning surge. This is a well-documented phenomenon where blood pressure rises sharply in the first few hours after waking. Your body releases stress hormones like cortisol and adrenaline. Your heart rate picks up. Blood vessels that were relaxed during sleep suddenly have to constrict and manage increased pressure. For a younger person with healthy, flexible arteries, this transition is usually smooth. The blood vessels adapt, the heart adjusts, everything flows. But as we get older, our arteries naturally become a little less flexible. They may have some plaque buildup. The smooth lining inside the vessels, what we call the endothelium, doesn't respond as quickly as it used to. So that morning surge, that natural rise in blood pressure, becomes more dramatic. The heart has to work harder to pump blood through vessels that aren't as cooperative as they once were. This means the morning hours are already a time of increased cardiovascular stress for older adults. Your heart is waking up, your blood pressure is rising, and your system is trying to find its rhythm for the day. Now, here's where that common habit comes in. I'm going to ask you to think about your own morning for a moment. Picture yourself waking up. Maybe the alarm goes off, or maybe you just naturally open your eyes as the sunlight comes through the window. You're lying in bed. You're still. You're calm. And then what do? For many people, especially seniors, the very first thing they do is sit up quickly and immediately stand up to start their day. They throw the covers off. They swing their legs over the side of the bed. They plant their feet on the floor and stand up, sometimes in one swift motion. It feels automatic. It feels harmless. After all, you've been doing it your entire life. But here's what I want you to understand. When you go from lying flat to standing up quickly, especially first thing in the morning, you're asking your cardiovascular system to make a massive adjustment in a very short amount of time. Let me explain what's actually happening inside your body. When you're lying down, your blood is distributed fairly evenly throughout your body. Your heart doesn't have to fight gravity to get blood to your brain. Everything is level. Everything is balanced. But the moment you stand up, gravity immediately pulls blood downward into your legs and lower body. Suddenly, There's less blood available in the upper part of your body, less blood reaching your brain, less blood flowing through the vessels in your head and neck. In a healthy, younger person, the body responds instantly. Sensors in your blood vessels, called baroreceptors, detect the pressure drop. They send signals to your brain. Your brain tells your heart to beat faster and tells your blood vessels to constrict. Within seconds, blood pressure is restored, and you don't feel a thing. But in older adults, this response can be slower. The baroreceptors don't respond as quickly. The blood vessels don't constrict as efficiently, and if you're on certain medications for blood pressure or heart conditions, that response can be even more delayed. So what happens? In those critical seconds after standing up quickly, your brain might not be getting enough blood flow. You might feel lightheaded. You might feel dizzy. Some people describe it as a wave of fog or a momentary disconnect. Many of my patients tell me they've felt this before, but they brushed it off. They thought it was just part of getting older. They'd grab onto the nightstand, wait a moment, and then keep going with their day. But here's what concerns me as a cardiologist. While your brain isn't getting enough blood in those first few seconds, your heart is working overtime, trying to correct the situation. Your heart rate spikes. The force of each heartbeat increases. Your heart muscle is contracting harder and faster, trying to push blood upward against gravity. And remember, this is all happening during that morning surge we talked about, when your blood pressure is already rising and your cardiovascular system is already under increased stress. For someone with underlying heart disease, even if they don't know they have it yet, this sudden spike in demand can be significant. It may increase strain on the heart muscle. It may cause temporary imbalances in oxygen supply and demand. In clinical practice, we've seen cases where these repeated morning stresses contribute to longer-term cardiovascular concerns. Now, I want to be very clear about something. I'm not saying that standing up in the morning causes a heart attack. That would be an oversimplification, and frankly, it would be irresponsible of me to suggest that. What I'm saying is this: the way you transition from lying down to standing up, especially in those first few minutes after waking, can create unnecessary strain on a cardiovascular system that's already dealing with the natural challenges of morning physiology and aging. It's not the standing itself that's the problem. It's the speed and abruptness of the change. Let me share another patient story with you. Robert is 76. He came to see me because he was experiencing frequent dizzy spells in the morning. He'd wake up, get out of bed to use the bathroom, and sometimes he'd have to grab the wall to steady himself. A couple of times, he'd actually stumbled. His wife was worried. She thought maybe he was having mini-strokes. She thought maybe his heart medication needed adjusting. We ran tests. His heart function looked reasonable. For his age, his medication levels were appropriate. But when I asked him to show me exactly how he got out of bed in the morning, I saw the issue immediately. Robert would go from flat on his back to standing upright in about 3 seconds. He was a former military man, and he still had that habit of springing out of bed like he was responding to a drill sergeant. His body, at 76, simply couldn't keep up with that kind of rapid transition anymore. I explained to him what was happening with his blood pressure and blood flow during those quick movements. And I suggested he might want to consider a more gradual approach to getting up in the morning. I didn't give him a prescription. I didn't tell him he had to do anything specific. I simply helped him understand what his body was experiencing, and I let him make his own informed decision about how to proceed. Within a few weeks, Robert told me the dizzy spells had essentially stopped. He said he felt more stable in the mornings, more alert, more confident on his feet. Now, who is most affected by this issue? In my experience, there are certain groups of older adults who need to be especially aware of how they transition from lying to standing in the morning. First, anyone with existing heart disease or a history of cardiovascular events. If you've had a heart attack, if you have heart failure, if you have significant coronary artery disease, your heart is already working with limitations. Adding unnecessary morning stress may not be in your best interest. Second, people with high blood pressure, especially if it's not perfectly controlled. That morning surge in blood pressure is already more pronounced in people with hypertension. Rapid position changes can compound that surge. Third, anyone on blood pressure medications. Many of these medications work by relaxing blood vessels or slowing heart rate. While they're doing important work to protect your heart overall, they can also make you more susceptible to blood pressure drops when you stand up quickly. Fourth, people with diabetes. Diabetes can affect the nervous system, including the nerves that help regulate blood pressure. This condition, called autonomic neuropathy, can make it harder for your body to adjust to position changes. And fifth, anyone who's experienced dizziness, lightheadedness, or near fainting episodes in the morning. If your body is already signaling that it's struggling with morning transitions, that's information worth paying attention to. But here's something that often surprises people. The damage from these repeated morning stresses doesn't usually announce itself clearly. You might not feel chest pain. You might not feel shortness of breath. You might just feel a little off, a little foggy, a little more tired than you think you should be. Many of my patients tell me they thought these feelings were just part of getting older. They'd say, "Well, I'm 70. Of course I'm a little dizzy in the morning. Of course I need a minute to get going." And while it's true that some changes are a normal part of aging, it's also true that we often normalize things that don't have to be normal. We accept discomfort or dysfunction because we assume there's nothing we can do about it. But knowledge changes that equation. Let me address some common myths I hear from seniors about morning routines and heart health. Myth number 1. If I'm going to have a heart problem, I'll definitely know it because I'll have chest pain. The reality is that many cardiovascular issues, especially in older adults and especially in women, present with vague symptoms or no symptoms at all. That feeling of being unusually tired, that sense of unease, that persistent morning grogginess, these can all be signs that your cardiovascular system is under stress. Myth number 2. Getting up quickly shows I'm still strong and independent. I understand this sentiment completely. Nobody wants to feel like they're declining or losing their capabilities. But true strength and independence come from understanding your body and making choices that help you maintain your health for the long term. There's no weakness in being thoughtful about how you move. Myth number 3. I've been getting up this way my whole life, so it can't be a problem now. Your cardiovascular system at 70 is not the same as it was at 30 or even 50. The strategies that worked for you decades ago may need updating. This isn't failure. It's adaptation. It's wisdom. Myth number 4. If my doctor was worried about this, they would have told me. Here's the truth. Most doctors, myself included, have very limited time with patients. We're focused on medications, test results, symptoms that you report. We don't always think to ask about the specific mechanics of how you get out of bed in the morning. That doesn't mean it's not important. It just means there's only so much we can cover in a 15-minute appointment. So, what do cardiologists actually watch for in real patients when it comes to morning routines? We pay attention to something called orthostatic hypotension, which is a fancy term for a significant drop in blood pressure when moving from lying down to standing. In clinical practice, we can measure this. We'll have you lie down, take your blood pressure, then have you stand up and measure it again. If there's a drop of 20 points or more in the top number, or 10 points or more in the bottom number, and especially if you're experiencing symptoms like dizziness, that tells us your body is struggling with position changes. We also listen carefully when patients describe their mornings. Do they feel rushed? Do they feel stressed? Are they jumping out of bed to respond to an alarm, to take care of someone else, to start a long list of tasks? Because here's something else that matters. It's not just the physical act of standing up quickly. It's the entire context of your morning. If you're waking up to a blaring alarm, immediately feeling anxious about the day ahead, and then forcing your body to go from 0 to 60 in a matter of seconds, you're adding emotional and mental stress on top of the physical stress. Your heart doesn't distinguish between physical stress and emotional stress. It responds to both in similar ways: increased heart rate, increased blood pressure, increased oxygen demand. So when we talk about being more aware of morning habits, we're really talking about the whole experience of how you start your day. Now, I want to be very careful here. I'm not going to give you a prescription or tell you exactly what to do. That's not my place in this context. And frankly, everyone's situation is different. What I can do is help you think about safer approaches to morning transitions. Many cardiologists encourage their patients to simply consider a more gradual wake-up process. Instead of going from flat to standing in one motion, you might think about it as a 3-stage process. Stage 1 would be becoming aware that you're awake while still lying down, taking a few deep breaths, maybe stretching gently while horizontal, giving your body a moment to start transitioning from sleep mode to wake mode. Stage 2 would be sitting up but staying seated on the edge of the bed for a bit. This gives your cardiovascular system a chance to adjust to the first major position change before you add the second one. Sitting with your feet on the floor, maybe for 30 seconds or even a full minute, allows blood pressure to stabilize. Stage 3 would be standing up slowly, and perhaps holding on to something stable for a moment, just to make sure you feel solid on your feet before you start walking. Again, I'm not telling you this is what you must do. I'm simply describing an approach that many of my patients have found helpful. It's about giving your cardiovascular system time to adapt rather than forcing it to catch up. Some people tell me this sounds like it would take too much time. They say they're busy in the morning, they have things to do, they can't spend several minutes just getting out of bed. And I understand that feeling. But here's what I tell them. We're talking about maybe 60 to 90 seconds. 1 to 1.5 minutes out of your entire morning, and those 90 seconds might be protecting your heart from unnecessary strain, reducing your risk of falls, and helping you feel more clear-headed as you start your day. When you frame it that way, when you think about the potential benefit compared to the minimal time investment, it starts to make more sense. I also want to acknowledge something important. For many seniors, especially those who live alone, there's a very real urgency in the morning. You might need to get to the bathroom quickly. You might be responding to a phone call or someone at the door. You might have a medical need that requires immediate attention. I'm not suggesting you ignore genuine urgency. What I'm suggesting is that on the regular routine mornings, which is most mornings, you might have more flexibility than you think. And I want to reassure you about something that worries many of my older patients. Taking your time, getting up in the morning does not mean you're failing or declining. It doesn't mean you're becoming helpless or dependent. It means you're being thoughtful and intentional about protecting your health. Some of the sharpest, most active, most independent seniors I know are the ones who've learned to respect their body's signals and adapt accordingly. They're the ones who are still traveling, still volunteering, still living full lives well into their 80s. Because they figured out how to work with their bodies rather than against them. There's a difference between giving up and being strategic. You're being strategic. Let me also address another concern I hear. What if you've already been getting up quickly for years? What if you've already put strain on your heart? First of all, the heart is remarkably resilient. It can adapt. It can recover. Making a change now, even if you're in your 70s or 80s, can still be beneficial. Second, we're not just talking about preventing dramatic events. We're talking about quality of life. We're talking about reducing those dizzy spells that make you feel unsure on your feet. We're talking about starting your day feeling more calm and centered rather than jarred and stressed. Those improvements matter. They matter a lot. Now, before we wrap up, I want to mention something else that's related to this whole discussion. Your morning routine doesn't end with how you get out of bed. What you do in the next 30 to 60 minutes also matters for your heart. Many older adults wake up and immediately start moving quickly through their morning tasks. They rush to take their medications, rush to make breakfast, rush to get ready for an appointment. They're bending over, reaching up, exerting themselves before their body has fully transitioned into daytime mode. And while I'm not going to tell you exactly how to structure your morning, again, that's a personal decision. I will say that many cardiologists encourage their patients to think about a gradual ramp-up rather than an immediate launch. Maybe you get up slowly, then sit for a few minutes while you drink a glass of water, Maybe you move through your bathroom routine without hurrying. Maybe you take your medications while seated at the kitchen table rather than standing at the counter. Maybe you eat a calm breakfast before you start tackling the active parts of your day. These kinds of considerations, this awareness of pacing, can make a real difference in how your cardiovascular system handles the morning. I also want you to know that if you're someone who wakes up frequently during the night to use the bathroom, this information applies to those nighttime transitions as well. In fact, nighttime wake-ups can be even more challenging because you're moving from deep sleep to standing, often in the dark, often half awake. Many falls happen during nighttime bathroom trips. Many dizzy spells happen during those transitions. So the same principle applies. If you're getting up in the middle of the night, sit on the edge of the bed for a moment before standing. Turn on a light. Give yourself a chance to orient. Your heart and your overall safety will benefit from that brief pause. All right, let's bring this all together. Your heart is most vulnerable in the morning because of natural physiological changes that happen when you wake up. Blood pressure rises, stress hormones increase, and your cardiovascular system is transitioning from rest mode to active mode. When you add a rapid position change on top of those existing stresses, going from lying flat to standing up quickly, you're asking your heart to handle multiple challenges at once. For older adults, especially those with existing heart conditions, high blood pressure, or other risk factors, this can create unnecessary strain. The habit of jumping out of bed quickly feels normal because you've done it for decades. But your body's capabilities have changed as you've aged, and what worked at 30 might not be ideal at 70. The good news is that this is something you can be aware of, and, if it makes sense for you, potentially adjust. Taking a more gradual approach to getting up, lying, sitting, then standing, gives your cardiovascular system time to adapt. This isn't about being fearful or feeling like you're broken. This is about being informed and making choices that support your long-term heart health and overall well-being. Small adjustments in how you start your day can have meaningful impacts on how you feel, not just in the morning, but throughout the entire day. And remember Margaret, the patient I mentioned at the beginning? After we talked about her morning routine and she started taking a more gradual approach to getting up. She came back 6 weeks later and told me that heavy feeling in her chest had lessened significantly. She felt more energetic. She felt steadier on her feet. Did we cure anything? No. Did we treat a disease? No. But we gave her body what it needed to function better, and that made a real difference in her life. That's what I hope for you as well. If you found this information helpful, I'd really appreciate it if you'd give this video a thumbs up. It helps other people who might benefit from this conversation find it. And in my next video, I'm going to talk about another common habit that many older adults have in the morning. This one involves something you drink. That can also put unexpected stress on your heart, especially if you have certain underlying conditions. So make sure you're subscribed so you don't miss that. Thank you for taking the time to learn about your heart health today. Take good care of yourself, and I'll see you in the next video.